Miss Victoria, our moderator today, may I check your speakers? Very beautiful.
Can you hear me?
Yes, very clear, ma'am.
Did you intend to bribe me? Happy to see you all and hope you're all doing okay. Hi, Jocelyn. Happy to see you.
Hi, Victoria. It's good to see you too.
Must be too early for you. Thank you for making it.
Of course.
Okay, I saw Mr. Ernest from PNG join us already. Hello, Mr. Ernest, can I check your microphone, please? Please open the microphone first. Please unmute. Could you please unmute?
Yes, I'm having some
Okay.
connection
Okay.
issues here, so I'm using my phone.
Okay, very clear now. I think all of us has joined our session today already. So I would like to welcome all participants and moderators of the RPHL Network GLLP ToT workshop. So this is our phase number 3. Actually, this is the last phase of our the first cohort. So very welcome to all of you. Thank you so much for your collaboration and your effort to complete the phase number 3. So today I would like to invite Ms. Chintana Siwongsa, our Regional Program Director of RPHL Network, to give us the welcome remarks. Please welcome.
Hello everyone and very good evening, good morning. I saw that PNG good night, but don't go to sleep yet, na PNG. Good evening, but don't go to bed yet. Yeah, we still have 1.5 hours to be together. So warm greeting from RPHL Network Secretariat. So today, I think I'm very excited that from our first planning up to now, right? Up to now, and we are in the 3rd phase already. But believe it or not, for the resource persons, we are very happy to share with you that full cooperation from all of the 25 participants, yeah, full cooperation. I think this is indicate how much interest and of the participant for this course, yeah, for this course. So let's move on to the 3rd phase. Yeah, what we are going to have today is that we will have 3 groups, yeah, 3 groups to have the presentation. Presentation already put it in the Google Drive. Okay, could put it in the Google Drive for you with the support from Tanyaporn. So we have 3 groups to come and share whether the adaptation of the curriculum. How was it? Yeah, how was it? And how was the group work help when you plan for the session as well, right? So we have 3 groups. And each of the group, we have the Q&A, and we do have the very good timekeeper. So Tanyaporn, she has her own way to let you know that this is over time already, so kindly stop, right? And then after that, we will open for the Q&A session, and followed by getting your opinion on the 3rd phase. So kindly spend another 5 minutes before we saying goodbye to each other to really give us your reflection, your thought, you know, and then we can have further improve for the 2nd cohort. And again, 2nd cohort is on the way, and I will announce to all of you very soon, very soon. So I myself today didn't dare to facilitate, but I do have the very, knowledgeable, excellent skill and knowledge on the GLLP. I do have two facilitators to support our learning session today. I have Miss Joycelyn Isidore, GLP manager, who is spending her early morning with us. Right? Is that early morning? Very too early. So much appreciate and grateful for your kind support today, right? In addition to that, not enough. Miss Joycelyn alone, not enough. We have Miss Victoria Katawira from WHO, from Wipro, who everyone knows her very well. You probably know that during the workshop, she gave a very good comment, right? Very, instructive comment, constructive comment for all of us. So today, once again, she will give her view and facilitate the session to all of the three groups, on all the three groups. The others, the other of the rest of participants, we also observe and learn as well today. So it's learning session. In addition to our participant, we also have the resource person from the regional to also joining us today. I saw from the list, I have Dr. Lin and the other as well to join us. Greeting to Virginie, Rita. I think we have the other Atan Sudarat to also joining us too, right? So
Yes.
it's complete set, by the way. Allow me to report to Joycelyn and Victoria, complete set. And we are about to kick off for the third phase. So I hand back the floor to you, Joycelyn, and Victoria. Ma'am, may I invite you to facilitate the session, please? Thank you very much for your time. Joycelyn, please.
Thank you so much, Jintana, and thank you everyone for joining and for putting the effort into working on the modules for this session. We really wanted this session to be an opportunity for you to practice adapting a module, to really get a good sense of what a full module looks like, and to really think about how you would adapt it for your country context or your regional context. Think about have the time that we didn't have during our in-person session, have the time to really think about what examples to use, what exercises make the most sense to support your learners. And we really wanted to give you a chance to do that, and then to have a chance to come together and talk about the process, talk about what worked for you, and discuss some challenges you might have had, and let you have the opportunity to ask questions. So with that in mind, I'd like to, Victoria, actually, if you would like to say anything, please go right ahead. And if not, then we'll jump right into the first group. But please, Victoria, if you have any words.
Yes, thank you so much, Jocelyn. I'm so happy to reconnect with many of you, if not all of you. We're wishing you the best today, and no pressure. This is just an exercise to further sharpen our skills, so enjoy. Thank you. Over to you, Jocelyn.
Thank you so much. So for our first session, we have the Laboratory Policy and Strategic Planning module that was done by our group from PNG. And I'd like to please invite Mr. Ernest to make your presentation. Thank you.
Thank you, Jocelyn and the panel members. If I can have the presentation. Thank you. Good afternoon from PNG. This is 8 o'clock evening here in PNG, and I'm not sure others what time it is. But thank you for having PNG have the opportunity to present. We've chosen this topic. There are about 76 slides to this presentation, but we have selected 10 slides to make up our presentation. So next slide. Yes, so this is the high-level view of the agendas that will be covered in the presentation. We will be going over the laboratory policy overview, policy development and review, and then we will shift to strategic thinking and developing a strategic plan. Next slide, thank you. So, firstly, to get us in the same page, there are, I think, definitions that we all need to be aware of. And the first definition is law. Laws are foundation. They are broad legal mandates created by a legislative body. In the case of PNG, we have the national parliament that creates these laws. Laws are enforceable, they carry legal weight, and can result in penalties for non-compliance. And they are often general in nature and set the overall framework for conduct. Then we have the regulations. They are developed by government agencies or regulatory bodies to provide specific details and requirements for compliance. Regulations are more specific than laws. They provide the how-to for meeting legal requirements. They carry legal authority and can result in fines or other penalties for violations. And then we have the policy. These are internal to organizations. They are guidelines or procedures developed to comply with laws and regulations and to achieve a specific goal. They are specific to organizational needs and contexts and provide a framework for decision-making and guide day-to-day activities. So in a nutshell, laws provide the broad framework, regulations provide the specific requirements, and policies provide the internal guidelines for compliance. Next slide. Next slide, please.
Kindly wait a minute. Please continue. Thank you.
Okay, can we go to the slide 4? Oh, yep. This is I think the slide okay, so now the scope of the national laboratory policies. The list here presents the domains that the national laboratory policy can and should influence for effective implementation. So there are elements of having a good laboratory system. It's crucial to understand that these elements are interconnected, and weaknesses in one area can undermine the entire system. So for this slide, the team have decided to have a group activity for this slide, and the group activity is we should separate. We would get the participant to divide into small groups, and each group will choose one of the components here of the laboratory policy, and the question to be asked or the discussion for the small group is, What are the biggest challenges in PNG related to the assigned scope area regarding lab policy? So each group would be given, they can choose each of these area of interest, and they can brainstorm on the area or the challenges that face the country. And then they can share to the larger group. So some of the questions that needed to be asked are, what are the biggest obstacles to implementing effective lab policies in this area? What are the most common complaints or concerns related to this area? What are the what resources are lacking or insufficient in this area? And how does it specifically affect rural communities or vulnerable populations? So those are the questions that will be in the group activity. Next slide. So then we have the policy development process. There are 4 considerations that must be that are critical to making the actual policy. And one is the establishment of a core national laboratory working group to develop the national laboratory policy. And this should this core group should have different expertise. There should be a diversity, and the group should have a collaborative spirit. Secondly, the engagement of all stakeholders. This is a key to ensure there is buy-in from all the other stakeholders that must be involved. Then there are multiple phases process in requiring planning and coordination. So to be aware of each of the steps and who is responsible for these processes. Then we have the approval mechanism for the policy. It is important for the group to understand what step does the policy needs to take in order to become officially recognized, and what stakeholders are needed to sign off on this policy. So as leaders, it helps to streamline these approval mechanisms so that efforts are not held up for unnecessary delays. And final approval policy that can be implemented requires efficient organizations for the approval mechanisms. Next slide. So establishing a national laboratory working group, there are 2 things to consider: composition of the national laboratory working group and the roles, the key roles in the policy development process, the roles they play. So for this slide, we also have a group activity, a group activity that will be given to ensure what will be the ideal expertise or persons to make up the national laboratory working group. We would have the participants to list those and justify why those are needed to ensure that will make up the national laboratory working group. Next slide. Then we have the policy development phases and review. As we can see, the policy development is a step process from start to finish. Phase one, formulation of the vision and mission. This is where the big questions are asked. What do we need to achieve? And then the situational analysis, formulation of the policy statement, policy establishment, policy implementation, and policy evaluation. So these are, so we can see that it's an ongoing process, and at the same time, monitoring and evaluation after it is implemented. Next slide. So now we shift to strategic thinking. Strategic thinking. There are key characteristics of strategic thinking. It is a active. Strategic thinking is an active activity. Is an activity prior to major decisions. Okay, the goal is to have the greatest amount of information as possible so the best decision can be made. Then it is one other characteristic is it is a way to think about, assess, and create the future. So some of the questions that is asked are, what does the future hold? What can be and what can we do to change it? So these allows organizations to take control and build for the future. Then the other characteristics is strategic thinking provides a broad analysis to understand potential impacts. Okay, strategic thinking moves beyond the immediate or obvious consequences. It encourages us to consider the second order, third order, and even distant impacts of our actions. Then it also focuses on a better future. Strategic thinking is fundamentally optimistic. We are not just planning for any future, but for a better future. In other words, policy is not meant to arm individuals, or the idea is a force of good and a need to figure out how to get there. Then the other characteristic is it precedes strategic planning. Strategic thinking creates the idea. So there are differences in strategic thinking and strategic planning. The next is strategic. What is a strategic planning process? So it involves the right people. It gathers information. It sets the mission, goals, and objectives. Strategic planning also involves critically analyzing strategic options. What course of action is most effective and why? And it assigns responsibilities, timelines, and budgets. Critical planning also produces written documents and divides specific tasks for completion and enlist external expertise in strategic planning. And lastly, the last slide. So this is the logical model diagram. It's about formalizing our thoughts from the top and seeing what occurs on the ground. So strategic plan should have inputs, activities, outputs, outcomes, and impacts. There should be a logical, visible view of all that needs to happen on the ground. So inputs are the resources that are required that we need to invest for the program. Activities are what specific plans are needed to be performed, and outputs are, if correctly done, the outcomes that are produced. And outcomes, if the process is added to positive results, the positive results that do occur. And the impacts are what has been improved or bettered. So this strategic or logical framework is kind of a roadmap that results to outcomes. So one of the activities that we plan to do is we have currently have a laboratory policy, and one of the policy statements, I think policy statement number 4 or 3, it states laboratories must ensure the provisions of quality and standard best practices approaches in all levels of healthcare. So the activity that can be conducted for this particular slide is generate a simplified logical framework for this policy statement. Put in having they can do create at the board or created in an Excel sheet, having inputs, activities, outputs, outcomes, and impact. Then can be presented to the greater group. So those are the activities that we can adopt for PNG context for this presentation. And in summary, policy drives planning. Policy deliberate a system of principles that guide future activities. Laboratory policies help to define mandate of institutions, organizations, providing enabling environment for all stakeholders to work towards one goal. Policy consists of context, vision, and mission, thematic areas with objectives and policy statement to reach objective. And policy is developed through establishing a working group, formulation of vision and mission, situation analysis, formulation of policy statement, policy establishment, implementation, and evaluation. Thank you. That's from PNG and the activities that would be adapted for this module.
Thank you very much for that. Yeah. Tanyaporn, do we have 5 minutes for some feedback and questions?
Yes, Miss Jocelyn.
Okay, thank you.
Like 5 to 10. Yes.
Okay, thank you very much. So thank you very much, Ernest, for that. It looks like you have taken just a few slides from the presentation. Just to confirm, you just selected these slides for this presentation. This would not be your full module for laboratory strategic planning and policy. Is that correct?
Yes, that's correct. We due to the time allowed for us, we just selected 10 out of the 79, I think, slides for this module.
Okay, thank you. So you did a nice job of pulling together a quick summary of different pieces of the module. So thank you for that. Um, and thank you for the ideas that you put into it as far as the new activities. I think they were certainly relevant for the content. One thing to keep in mind when you start adding new activities, which I encourage, however, as you do that, you really need to keep in mind the time available to you for the implementation of the module, because activities tend to take a long time. They often add really good conversation, but that conversation takes time. So it's just something to keep in mind as you are adapting a module, is to really think about the time you have available for that module and then adapt accordingly, making sure you're building in enough time for the exercises, because they can take considerable time. So that's just one thought.
Mm.
Victoria, I'm going to pass to you to see if I do have some other thoughts, but I want to give you time as well, Victoria. So Victoria, I'll pass to you for any comments.
Yes, thank you, Jocelyn. It's okay, proceed. I will then ask a few questions at the end. But thank you so much to the group for presenting. Over to you, Jocelyn.
Okay. The other thing I wanted to suggest to keep in mind is that as you are adapting material, you may be taking material out, you may be adding new material. But as you do so, you want to make sure that the competencies that are addressed at the very beginning of the module, so in the second or third slide of the module, there is a list of, it's right after the module objectives, there's a slide that lists the
Mhm.
competencies from the Laboratory Leadership Competency Framework that are addressed in that module. And you do want to make sure that the content that is retained in the module covers the competencies that are listed on that slide.
Okay.
And then I would just ask if you had any challenges that you can speak to in the process of adapting the materials. Were there any challenges that you encountered?
Because I think one of the challenges developing a national laboratory policy is kind of, we are going through that phase now. It's a new experience for us. We are going back and forth with the senior executive management and for endorsement of so there are, I think there are in-country processes that we need to adopt. I didn't have we didn't present, but those are some of the things that can be made aware that there are in-country processes that we can adopt.
Thank you for that. Did you say that I'm sorry if I misheard. Did you say that your lab policy, you do or do not have a lab policy in place, or you're in the process of developing one?
It's in the process. It was submitted to the senior executive management, and they had the feedback. So we are the team, the laboratory technical working group is responding to, and this week, starting from yesterday, today, and tomorrow, we are reviewing those comments and fine tuning before it's submitted to the policy division for their to proceed with the processes.
Very timely topic. So
Exactly.
oftentimes, yeah, oftentimes in a module, we will ask for country-specific examples. For example, I believe this module asks for you to provide your participants with a copy of the strategic plan and a copy of the national laboratory policy. If you don't have it, that can be a challenge. But then I would suggest that you adapt the module to provide that outline of what a policy or a strategic plan is, and then you can perhaps even start thinking about what it would take, if you don't have one at all, what it would take to start to implement or develop a lab policy or a laboratory strategic plan. So there are ways to adapt the material depending upon what's going on in the particular country.
Yes,
I'd like to open it up
Jocelyn,
to, yes, please.
Jocelyn, if I can make a comment on this. So today we had the presentation from the policy division. We realized that we could have known the processes and the development phases that the policy division has. It was regretful that we didn't have the prior knowledge. But now that we know what the processes are, we kind of, ensure that it's formulated in the form that it needs to. Tomorrow session, the team has asked the team that came for the GLLP to present the GLLP experience. So we will be presenting. So that's another good avenue for us to sort of say there are GLLP consortium that can be reached to for support in this phase that we are going through.
Excellent, excellent. Thank you so much for that. The other thing that I just wanted to note, I did notice that you changed some of the photographs. That's wonderful. Thank you for changing photographs and making it more personal for your country. One thing to keep in mind if you're changing photographs or you're adding graphics of any sort, if it's not, you need to make sure if there's any author or any photographer or artist that needs to be acknowledged, you want to make sure that you add that acknowledgement. If you notice on the photograph that's shown on the slide, underneath it there's a copyright line showing that the photograph comes from WHO and that is the photographer's name. So if you're using photographs that have any sort of copyright, you want to make sure you have the permission to use them. If you're using photographs from a photographer or from yourself, you want to just make sure that you add a line that gives an acknowledgement of the photographer. I think we may be running out of time. Victoria, Rita, Virginia, any other last comments from you? I want to make sure we have time for everyone today.
Yes, thank you. Thank you, Jocelyn. I will just add to your voice. One, to thank the team for adaptation, especially for the photos as well as the exercises. I felt like that was a very good thing. And just like Jocelyn said about the exercises, be mindful of the time because you're using exercises that are applicable to the local context. There's generally more interest and therefore more contribution from the participants, and that usually takes more time. So sometimes if you're able to run a mini pilot, perfect. But if you're not able to, use your knowledge of the context and the team or the participants and adjust the timing accordingly. And yeah, she's highlighted, I wanted to talk about the copyrights for the photos, but that's been addressed by Jocelyn very well. I would have loved to hear from the rest of the team, even if it's just responding to the questions, because this phase 3 is mainly sharpening the skills in adapting these modules to be able to deliver the training in a way that makes sense to your audience. So we appreciate that we've heard from 1 of 4 but I think it would be good. It would have been good to hear from the rest as well, even if it's responding to questions or at least an extra voice to see what happened. Also, just taking us through what you changed on a slide would be very helpful to kind of flow in, okay, for this slide, you notice we changed this because this makes sense to our context. You highlighted that especially for the exercises. I would have loved to hear more about it in the content itself. And I think that's why Jocelyn talked about the part of the policy where if you don't have the policy, then you put the outline. But if you have it, that's when you talk about sharing it ahead of time, or at least with the participants, making it available to them. Also, maybe this is for the next groups, if you can just give an overview of the adaptation process, the fact that you are working as a team, and many of you are not from the same unit or division or even ministry, just for us to pick lessons from that adaptation at that level, because this is what is going to be a reality when you move into facilitating these trainings. And I believe others will learn from your experiences. Thank you so much. Over to you, Jocelyn.
Thank you, Victoria. Virginia, Rita, any comments from you?
Jocelyn, I take the floor just 1 second to say thank you to everyone and congratulations, PNG and Dr. Ernest, because you're the first in line. So the other will benefit from the comments. And yeah, to reiterate what Jocelyn and Victoria said, some of the modules, and this one is a good example, the activities and the amount of information provided will vary depending on if you have or if you don't have some, like the lab policy, the strategic plan, etc. So it also valid for other modules. So it's just a generic comment. Thank you very much.
Thank you, Virginia. And thank you, PNG, for your hard work and for your presentation. We'll next move on. Yes, please.
No, I'm just saying thank you so much.
Oh, well, thank you. Okay, now we will move on to Vietnam, and they have prepared the module on research and innovation. And so we'll move to Dr. Pham, please.
Yes. Thank you for your introduction. So, good afternoon, everyone. Hello, can you hear me?
Yes, sir.
Yes,
Very clear.
Good afternoon, everyone. So I'm Hưng from Vietnam, and today I'm very excited to be here to present my models with my teammate Miss Thanh. So we have prepared this module with the kind support from Miss Ling, one of instructor from GLLP program, and so we truly appreciate her guidance. So in research and innovation topic, we believe this topic is already quite familiar to many of you. So today's discussion will build on the knowledge and experience you have already. So let's keep the energy up and learn together. This module is part of GLLP. So after complete this module, the participants will achieve 5 key objectives. Firstly, they will be able to define health-related research and explain the critical roles of laboratories in conducting health-focused study. The second, the participant will understand how to design and review research proposals, ensure they meet scientific standards. The third is the module emphasizes ethical principles, helping learners recognize and apply them into the research activities. The fourth is highlight the importance of communicating research findings, ensure that new knowledge reach decision maker and the public. And finally, the participant will learn how to foster and research environment that encourage innovation and collaboration. So next slide. before we starting with the research and innovation module, learner and participant are expected to complete several related modules within GLLP. They include leadership and strategic thinking, and ethics and integrity, proposal thinking, proposal writing. Next slide, please. This module, research and innovation, we have five content: the type of research, legal and ethical consideration in research, research proposal and funding, innovation, and wrap up in the module content of this module. But because the limited time, so today I just talk about the research and innovation with the more detail about the type of research. So next slide, please. So this slide show the basic structure of health research system. It begins with the people, institution, and their activities, which together to generate high quality knowledge. This knowledge, when applied effectively, lead to improved health outcome. And so in every country, both national and international health organizations will play a key role in supporting this process. Next slide, please. In Vietnam, the national health organization like Ministry of Health, MOH, are responsible for leading health research and policy. So they collaborate closely with the international organizations such as the WHO, WHO, and FAO. So their partnership helps generate high quality knowledge that support public health program and improve health outcome across the country. So you can see in the slide at the top, the Ministry of Health, MOH, oversee on health related to function. Under the MOH, the department and research institutes like Pasteur Institute or NIHA, etc., health policy and technical experts. Some medical universities training healthcare professional responsibility. At the province level, health department operates under the pupil committee and manage the hospital, the preventive medicine center like CDC in the province level, and sub-department of animal health and food safety. Finally, commune health station provide the most accessible primary care service to population. So this multi-tier system support both curative and preventive health service across Vietnam. Next slide, please. So it talk about One Health collaboration. So beside the MOS, the responsibility for human healthcare. So this diagram show the organization structure of the veterinary sector under the Ministry of Agriculture and Environment in Vietnam. As you may know, before the 1st of July, we are the separate the Ministry of Agriculture and Ministry of Environment. But after the 1st of July, we had to merge. We have merged the Ministry of Agriculture and Environment combined with one ministry. So now the very new ministry is Ministry of Agriculture and Environment. So this ministry will be like control on everything related to the agriculture, include animal health, something, and environment health. So the center agency in this diagram is the Department of Animal Health. So which coordinates with the region veterinary office, quality center, drug control center, and hygiene inspector center. Their institutes support diagnostic disease surveillance and control nationwide of animal health. The system include veterinary training school like university, like my university, and research institute and vaccine companies as linking science, education, and practice. At the local level, like province level, the sub-department of animal health under province agriculture department supervise animal health service, which are delivered through district and commune vet team. This system connect closely with human health sector through collaboration on zoonotic disease control and food safety. So ensure early detection and respond to threats that affect both human and animal. Next slide, please. So in this slide, highlight the core principle of research excellence. Excellent research must be high quality, ethical source, and rigorously conducted. It should also be original, bringing new insight, innovative, offering creative solution, and reproducible. Meaning we can everyone can verify the results. Next slide. The slide define research as the process of investigation, experimentation, evaluation with the goals of discovering, interpreting, applying new knowledge. It's the essential in advancing human, animal, and environment health. So research can be categorized into 5 types, as you may know. The basic research, this will explore the fundamental principle. Applied research shows the practical problem. Clinical research will test treatment or intervention. The system and service research will be examine how health service are delivered. And the last one is translation research, apply finding to real world health outcome. Next slide. I would like to talk about the basic research. This can call by fundamental research. It's aimed to generate new knowledge by explore how things work at a deeper level. Often work in laboratory, in vitro, as you may know. So without immediately focus on solving practical problem. For example, in the human. So please just put next. It will be. Please next. Yes. For example, in human medicine, studying how virus enter the human cell, and in the veterinary medicines, we will can be investigating the immune response of the animal, like chicken, like pig, to a new pathogen. So the goal is understanding, not direct application, just understanding. Through the is often lay the foundation for future applied clinical research. Next slide, please. Instead of discovering new knowledge like basic research, it uses what we already know, scientific data, past studies, and expert practice. So to find practical solution to real-world problem, like improve farm management, treating an outbreak, or optimizing a vaccine program. So this please push the next. Will be yes. For example, some research, applied research, like develop a vaccine for AI. It's been avian influenza, and in humans we can testing the effectiveness of the new antibiotic on multi-drug resistant bacteria. That's the example for developing a new diagnostic test for specific disease in applied research. Next slide, please. Next slide, please. Yeah. Clinical research is focused on evaluating medical intervention, such as drug vaccines, surgical procedures, or diagnostic tools in real pathogens to determine their safety, effectiveness, and potential side effect. So, example, we can compare a new diagnostic procedure with current practice in clinical testing. In the human, a clinical trial to test if a new COVID-19 vaccine prevent infection in adults. And for the veterinary, we can test whether a new deworming drug is safe or effective in treat hookworm in dog. Is very famous, very popular in the dog. Next slide, please. This refers to health service research system and service research. It investigates how healthcare systems are structured, funded, and provided, and evaluated how their factors affect access, quality, cost, and outcome of care for population. Example, study whether telemedicine improve access to mental health service in the rural communities. We can research in evaluating how mobile veterinary clinical impact vaccine raised in a remote farming area. Next slide, please. Translational research. So this research is focused on turning basic science discovery into public health impact. It applies research finding to real-world setting to improve population level outcome, such as the disease prevention, health policy, for education. In short, this we can a little bit confused about applied research and translational research. But we can separate in short, like applied research is problem solving in specific contexts, and translational research is moving scientific discoveries into the real world health solution. So, for example, some research focus in translational research, like using research on HPV vaccine to develop and implement national vaccination program in school, or applying finding on avian influenza transmission to design and for regional biosecurity and vaccination campaign for poultry farm. Next slide, please. So to wrap up this section, we have just explored the different type of research, from basic and applied to qualitative and quantitative. So each type play a unique role depending on the goals and context of study. So understand their categories help us to choose the right approach for our research question and set a solid foundation as we move forward in the discourse. As I mentioned in the previous slide, because the limited time, so today I just talk about the first content of this module. Is mean the tip of research. So I would very happy to hear any feedback or question you may have about my presentation for this section. Thank you very much.
Excuse me. Thank you very much for that presentation. I think you did a very nice job of summarizing, again, a much longer module. I wonder if you can, I did notice some of the adaptations that were made in the slide, but I wonder if you might be able to please point out some of the changes that you made, just so that everyone's aware of how you adapted the module for your purposes.
Dr. Pham, please unmute.
Yeah, sorry. Yeah, for this session for research and for the tip of research, uh, some knowledge in this regions. I just talk about any information as we can know very clearly, very familiar as all of you. So when we adapt with our country, especially for me in my faculty, my school, we can training for student, we can training for our colleagues about how to like identify the research category, research tip when they start for the apply to the like some foundation, some grant to ask about the funding for research, because in our country, in our university, we have many fund, we have many grant for enhanced capacity of research, enhanced capacity in of the young scientists to do the research. But we very like we very separate every tip, every category of research, applied science, applied research, or basic research, something like that. Because as depend on the purpose of every research, the organization or the funding will be decide which research will be adoption will be suitable for this, for the funding. Yeah. Thank you. Thank you for your question.
Thank you very much. So, some of the changes that I saw that you had made, I think it was very nice at the beginning where you showed the structure within Vietnam, and you included the all three of the sectors. So that those two slides I think are a very nice addition. It reinforces learning that you may have presented earlier in the course as well. Also on the slides, on the types of research slides, I believe you added specific examples to the slides. So if you keep going, Tanya Porn, please, to the next slide. And maybe click again. Does that add an example?
Yeah, put more. Please put.
Yeah, click once more.
Yeah.
Hello, Jocelyn. May I add some comment? Yeah, we
Yes,
have.
please.
Yeah. Firstly, you can see from the slide 7 and slide 8, Dr. Hưng present about the structure of Ministry of Health and Ministry of Agriculture and Environment. From the structure, you can know how we can apply for the fund from national level for the research fundings from the department and the facility in health sector, in the environment and animal sector. And you can see another slide below. We also add more the example for the type of research. It is our research from Viet Nam, come from animal sector and environment and health sector. As you mentioned that we also edit some picture. You can see Dr. Hưng in this picture. So that is very reality and very implemented by ourselves. Yeah, that is my comment for now. Yeah, thank you.
Yeah, excellent. So on the types of research slides, you did add very specific examples to Vietnam, and that's excellent. That's exactly what we're looking for, is really trying to personalize the content so it's very relatable to the learner. If you go to the next slide, please, Tanya Porn, I think, yeah, right there. So one more click. Yeah. So that development of vaccine for avian influenza and testing the effectiveness of new antibiotics on multi-drug resistant bacteria. Those were specific examples that were added by Viet Nam. So that really is the kind of thing that we're looking for, something that makes the content really relatable to the audience. So I know we're short on time. Victoria, I'll pass to you for any other comments.
Yes, thank you, Jocelyn. I'll make this very brief, and thank you so much to Team Vietnam for the job done. You've put in a lot of effort, and it's clearly visible in especially highlighting the specific context examples. I would like to suggest that to take it a notch higher, you can take screenshots of publications from Vietnam in this area. I know there are many publications. Vietnam has done quite a lot of research, and this is feedback that's applicable to other countries and colleagues as well. Just get a snapshot of what was published, because it brings the message home and makes the participants or the trainees identify with and understand better. I also like the fact that you used some Vietnamese in here, and I'm hoping that in actual training, you would do that, because it enhances understanding, especially because that's the dialect they commonly use. Otherwise, thank you so much, and congratulations to the team.
Hi, Joycelyn, I have a question. I know that we run out of time, but from what I participate as the mentor for the class of GLLP, what their small project, a capstone project that the mentee are working on, what I consider is like operational research, right? Try to improve what they see the challenges in our laboratory. So I don't know, like this kind of operational research apply to in what category? We have 5 category here, right? Apply, basic research, and all kind. Yeah. But the small project is more the operational research, yeah, that we are working on it. And sometimes when we go to this subject, the mentee say it sometimes it's too deep, for them. Just something, their comment from the class, yes.
Thank you for that. So your question is where would the small, you would consider the small projects and the capstone projects to be operational research. We don't have operational research as one of the 5 categories of research. So you're asking under which of the 5 categories would we place operational research?
Yeah.
And I'm just skimming through them right now, and I'm going to ask any of my other colleagues. I'm just looking through them quickly. I would, my first reaction would be that it would be under applied research, but or perhaps translational. Any other thoughts from others on the team?
Jocelyn, thank you. I think depending on the exact small project, I'm moving quickly back to that. I think some of them would fall under applied, and others would fall under systems and services. So sometimes there's a thin line, but they're all covered. What we usually take as operational research could easily fall in the applied as well as the systems and services. But it depends on the actual project and the nature it's taking for you to comfortably place it in applied or systems and services. Thank you.
Or we add like another topic, operational research separately. I don't know, because what I see, like observe what our mentee select the topic is more like operational research, or sometimes when we're working in the field, like on epidemiology or outbreak investigation, most of the thing we always call it like operational research, something like that. But if you think that it fit with any one of five, I think that's fine also. Yeah.
Thank you. Maybe just to add to that briefly, I think this will be considered, and I understand where you're coming from, because the usual language in the public health sector or global health sector is operational research for that kind of research that's non-clinical and non-experimental. So we can, maybe the Secretariat can consider that to see if they want to reconsider that language to take into consideration operational research, which is becoming very popular and of course very useful in the current context. But that's very well noted. Thank you so much.
Thank you.
Over to you, Jocelyn.
Thank you. And of course, if in your environment, operational research is the term that's used, and you want to make adaptations, then that's certainly possible to do as well, to add that operational research as needed. All right, so our next team is from Chulalongkorn University doing outbreak investigation. And Dr. Sawang, I believe you're going to be presenting, so I'll pass to you. Thank you very much.
Okay, thank you. Can you hear me?
Very
ชัด
well.
เจนค่ะอาจารย์
Okay, Thanyapon, could you show the slide? Good afternoon, good morning, and good evening, all participants. And it's my great pleasure to share about our module selection. Today, I would like to talk about the outbreak investigation, and we are the group from the Chulalongkorn University. Our team, we have the 3 members, including Dr. Panan, Dr. Theravit, and me. And in the outbreak investigation module, next slide, please. Yep. The participant will be able to identify the key component of an outbreak investigation, describe the basic function of outbreak response team, and reflect on the role of laboratories in the outbreak investigation. The next, please. Yeah, in this module, they also related with the 4 competency domain in the
อาจารย์คะเสียงหายไปค่ะอาจารย์คะเสียงหาย ฮัลโหลค่ะอาจารย์ได้ยินไหมคะ
Yep, I hear.
โอเคค่ะ
But I cannot see the screen. Okay, next slide. Hello, ได้ยินไหมครับ
ได้ยินค่ะอาจารย์ลองพูด
สไลด์มันไม่ขึ้นนะครับ
ยังไม่ขึ้นเหรอคะ
ตอนนี้มาแล้วนะคะ
มันของผมยังขึ้นmodule agenda okay, thank you. For the module agenda, the first one will be the overview of the outbreak investigation, and the next is the phase of the outbreak, including the description, explanation, response, and the last one is the activity. But in for the today, we have the time limit. We just focus on the phase of the investigation, especially for the descriptive phase. Okay, the next, please. Okay, the overview of the investigation, the next. Okay, when we face with the outbreak, what is the outbreak? The outbreak is the increasing of the case of the disease or the problem in the particular place and time. The key component to mention about the outbreak is the link of the disease or illness in the specific location, time frame, and the population. Please keep in mind this is the three components to mention or to think about the outbreak occur when we have the problem in our situation. Oh, I'm sorry, I forgot to tell you that the slide that I will modify, I will put on the red star on the upper right corner. Okay, the next please. Yeah. The objective of the outbreak investigation, when we have the outbreak occur, we need to identify what is the agent, what is the source of the outbreak, and what is the mode of the transmission. Why we need to know about these three aspects of the outbreak, especially for the infectious disease. When we handle or we're dealing with the infectious disease, we have the three components that we need to think about. The first one is the host, including the human and animal. The second one is the agent, and the last one is the environment. If the three components come together in the proper time, the disease can be occur. And recently, many diseases caused by the environment, like some toxic substance or poisoning, and some infectious disease can have some evolution and have more problem, or like some climate change, they can have the favor for some infectious disease to extend for a long time in the environment and have the human or the host have the chance to got the infection. Okay, the next please. Yeah, and why we need to investigate when we have the outbreak. The important one is we need to control the outbreak. The second one, we need to mitigate the problem. And the last one is we need to prevent. And also we need to evaluate the impact of the outbreak on the economic aspect. And the another important one is when we have the outbreak, we need to learn about the outbreak, and sometimes we need to learn from each outbreak, and we can use our learning from each part of the outbreak for the further outbreak. Okay, the next one. Yeah, and how we know we have the outbreak in our community. We need to use a surveillance system, monitoring system, or even the reporting system. For the surveillance system, we have both the routine, symptomatic, or laboratory system. And for the reporting, also from the public health sector, from the healthcare provider. In the surveillance and monitoring system, we need to have both passive and also the active system to look after what happened in our community. And the another one is from the another method, including from the many media. Like recently, we have a lot of the platform to share the case or the problem. Like in Thailand, when we have the problem, the African horse sickness. Firstly, we don't know we have the problem in our country, but we have many people post about the horse will have the neurological side or have the problem in their own horse. And after that, we have the team to investigate what happened in the horse in Thailand. And we find out that we have the problem of the African horse sickness. Okay, the next one. Yeah, however, even we have that, the increasing of the case is an outbreak. Sometimes increasing is not the outbreak, because if you have the more interesting or more lab capacity or more sample or big population, sometimes they have the increase of the case number. That is not the outbreak. If you want to confirm the outbreak, you need to think about the connection or the link between each case, the specific time, and the specific population, the specific location. That is a three component to confirm that you have the outbreak in your community. the next one. Yeah, when we have the outbreak and we would like to investigate the outbreak, we need to have some collaboration between many sectors, like the lab sector, human or veterinary sector, epidemiologists, toxicologists, or even the environment. The collaboration of each sector is so important to investigate because no one can do all aspects for the investigation. Okay, the next bit. Yes. I and my team always work in the lab. We would like to emphasize that the role of the laboratory in the outbreak investigation. For the lab should be provide a diagnostic expertise and some knowledge about the what we should do about the investigation, like how to collect the sample, how to prepare the sample, how to transmit, what is a sample size or whatever that is involved for lab to investigate what happened or what is the cause of the outbreak. Okay, the next screen. Yeah, and this if you would like to have more useful for the lab, you need to provide some informative that you can recruit from the field or from the case, and also the sample is so important for the lab to confirm. Okay, the next please. Yeah, that is the phase of the outbreak investigation. We have the three phases: the descriptive, explanation, and response. I will focus just only in the descriptive phase. Okay, the next please. Yeah, this is like for the animal outbreak is also quite similar with the human, but for the animal, when we have the investigate, sometimes we need to have some communication with the stakeholder. That is so also important for the outbreak investigation in the animal disease. Okay, the next please. Yeah, for the descriptive phase. The next please. Yeah, the first one we need to assessment the situation. What is the problem that occur in the community? What is a lab confirmation and what is a breakout of factor that can involve in the outbreak when we have the problem in the community? The next one. Yeah, and before go to the field for collect the sample, it's so important for the good planning. And that is why we need to communication between the lab sector and the field team. We need to prepare what is important sample or important information that the team should recruit from the investigation and how to prepare the equipment or whatever. And I highlight the red color. The biosafety is so important because when we have the outbreak, especially for the infectious disease, we need to think about that our material is a biohazard agent. The team should be put on the proper PPE. That is so important. We don't want the team to have the chance to expose to the infectious agent. And when we collect the sample, we need to decontaminate our equipment that we bring back to the lab. We don't want to spread from the team to go to the field for the investigation. The proper PPE is so important for the team to go to the place for the investigation. Okay, the next one. Yep, that is when we think about the sample collection, when we went to the field for investigation, we need to have the three phases. The first one is a pre-collection. We need to think about that. What is the proper time for the collection of sample? What kind of the sample? What is the equipment or method, and or even the storage? And for the collection time, we need to think what kind of the tissue that we need to collect. And that is information that we can retrieve from the lab. What is the proper specimen for the lab to run the laboratory test. And after that, after we collect the sample, what is a transportation, what is the package? As I say, the biosafety is so important, especially when we handle with the infectious agent. Okay, the next one. Yeah, that is the type of the specimen or sample, including from the antemortem specimen, like some nasal swab, blood sample, or whatever. Sometimes we can collect even the feces. Sometimes when we go to the field, especially for the animal, if they have the animal die, we can collect the sample from the postmortem specimen. Sometimes the problem caused by some parasite, we can also collect the parasite, or even the non-human or non-animal sample, like a feed or fish stuff, air, water, or whatever that located in the specific area that we go to the investigate. Okay, the next one. Yeah, that is the type of the alternative collection specimen. Recently, we can like in animals, sometimes when we collect the sample, some people concerned about the animal welfare. We need to have the alternative method that is non-invasive, like collect the oral fluid, or sometimes we can use the processing fluid that collect from the routine work in the farm, or like in the human, sometimes you can use a nasal swab or non-invasive, like a sputum or whatever, that is non-invasive technique for the patient. Okay, the next one. When the sample arrive to the lab should be to clarify that the specimen is proper for run the test or not. If done proper, you need to discharge and tell the team to collect the another one. Because if you put the improper specimen, you can recruit the improper result from the lab test, like a garbage in, garbage out. Okay, the next one. Yeah, that is about the lab search capacity during the outbreak. When you want to use the lab, you need to know about the lab capacity. What is the maximum capacity? How about the people or staff in the lab, the lab capacity, lab technique or whatever, that you need to have some communication between the field team and the lab. Okay, the next one. Yeah, when we have the outbreak occur, we need to confirm that we have the real outbreak. As I mentioned previously, we need to think about the people or animal, who is a which group, and what is a case definition or case information that involved in each outbreak. What is a specific location or even a specific time. That is a 3 component that to fit that we have the outbreak in our community. The next please. Yeah, this I would like to emphasize this is ecology for the investigation. Like in the upper panel, many outbreak of the zoonotic disease in human. Many problem is like a trans-species transmission from the wildlife. Like previously, we have the Nipah virus outbreak in Malaysia. The Nipah virus harbor in the bat, but they didn't induce any problem in the bat. But when the Nipah virus transmit from the bat to the pig, it's amplified in the pig and also induce the disease in the pig. And from the pig, it can transmit and have the problem in the human. That is so important. That why I think that 3 components of the outbreak is including the time, place, people. That is the key point. And if we know about this ecology of the disease, and we have the rapidly respond, we can stop the outbreak. Like if we know that the problem of the Nipah virus from the bat to the pig and from the pig to the human, and if we stop the connection between the bat and the pig, we can stop the Nipah virus. Okay, the next one. Yeah, and this the second step is a outbreak control team and a rapid response team. That is a team that who should be promptly to respond when we have the problem, like go to the investigation or even the control the problem to mitigate the the outbreak that occur. The next one. Yeah, this is an important key for the outbreak investigation, the case definition. We need to clarify that is the case that we found in the outbreak is fit with the case definition or not. We need to think about the clinical sign. We need to think about the laboratory confirm. And also we need to think about the stakeholder that involved. Okay, the next one. Yeah, that is an example in for the streptococcal toxic shock in Thailand. The rich people is like people who have the acutely illness developed after the consume of the raw spicy mint pork, or in Thai we call the lap dip. This problem quite common to occur after we have the local investigation. People from many places go back to their hometown and they have the party in the festival and they eat together. That's quite common during the Songkran festival that held in the April in each year. And after they have the party, many people develop the high fever, skin rash, hearing loss, or some people have the collapse. And when they went to the hospital, the doctor can isolate the Streptococcus suis from the blood or from the CSF of the patient. That is an example of the case definition of the Streptococcal toxic shock syndrome in Thailand. Okay, the next one. Yeah, that is a T-tier classification. The first one is a suspected case, is the case that have the compatible symptom. The probable is the case that have the compatible symptom and the epidemiology linked to the problem. And the important one is a confirmed case. You need to use the lab to confirm incompatible with the symptom. Okay, the next. Yeah, that is a composition of the team for the investigation. Is not just only the epidemiologist or the clinician. Sometimes we need to use all sector that involved in the outbreak. Like in Thailand, sometimes we need to use the police or soldier for involved in the investigation, not just only the healthcare provider or health sector. Okay, the next one. Okay, please go to the slide number 43. Yes, because of the time limit, I have the example of the disease in animal in Thailand. Like in the January 2001, we had the 7 important pygmy goat to Thailand to destined as a pet animal. And we found that during the quarantine period, some of the goat developed the respiratory distress and diarrhea, and some die. And the die animal was submitted to our department for the necropsy and to find out what is the problem in this goat. And when we necropsy, we found that goat had the pneumonic lesion, and on the histopad, we found the lesion compatible with some viral, because we found the syncytial cell inclusion body that is compatible with the paramyxo virus infection. And in Thailand, we never have the problem of the paramyxo virus in the goat, and we don't know what is the cause, but we know that it could be the paramyxo virus after that, we have the consult with the expert from the USA, and they suggest us that we have the problem that quite compatible with the pest diabetes ruminant or PPR. And what we do the next step, during the necropsy, we also collect the sample, like the lung, the lymph node, or the other organ that have the lesion. And we also submit the sample. The next slide, please. Yep, we submit the sample to the National Institute of Animal Health, who have the lab capacity to identify that we have the PPR or not. And luckily, we found that our submitted tissue have a positive for the PPR, that we confirm that we have the case of the PPR in the imported pygmy goat. And what do we do in the next step? Some of the goats still alive. We have another team to visit the farm to investigate the problem and also collect the serum sample for test that the remaining goat have the export to the PPR or not. And we had the another team in our faculty to develop the serum neutralizing test for the PPR. And we found that it have the positive, that is the confirmed. We also confirm that the remaining goat have the exposure risk. And what do we do? We also send the letter. We send the sample to the. We send the letter to the DLD, the authority, to know that we have the PPR outbreak in our country. And what do? They send after they found the PPR, that is a disease that we need to control. And as a OHA, or World Organization of Animal Health, they would like to eradicate this disease by the 2030. And this is also the important disease in the goat industry. The authority went to the farm to stamping out or the population of the animal that have the risk. And luckily, after we rapidly identify the outbreak and we have the rapidly respond to condemn out the remaining goat in the same area. From the 21 to now, we don't have the PPR case in Thailand again. That is important for the outbreak investigation. We need to have the rapidly response, and we have to have some collaboration between the field and the lab to confirm the existence of the outbreak. And the next step is a response team to control the problem. That is all of my presentation. Okay, thank you.
Thank you very much, Dr. Sawang, and thank you for adding the really excellent examples from your country, for especially in the outbreak investigation module. There are always really excellent country-specific examples that can be added that really the audience can really relate to and understand and be engaged with. So thank you for that. I did also notice that you had added some graphics to support some of the text, and that's excellent. Thank you. You also, I did notice, changed the font color and the color in order to emphasize some information. So again, another nice addition to really try and adapt the materials for your audience. I know we are very short on time. I would ask if you had thought about, when you were reviewing the module, and this is to any of you on the team for this from the university, did you consider making any changes to any of the activities that were that are in the base module?
In our module, we don't have the time to adapt the activity because we have the time limit. Yep. It's also I also put some example or activity, but it's have the time limit. That's why I skip some activity and move
Yes.
to show the example.
Okay, excellent. It's a very long module with a lot of content, so I certainly understand that. Victoria, did you have any other specific questions or comments?
Thank you, Jocelyn. You addressed the question on activities because I was keen to understand what considerations they have for the change of activities. I like the examples they've given, especially the one on PPR, and I can imagine if presented to a local audience, they would have a lot of interest just to understand what was happening. Thank you so much to the team from Chula University. You did an amazing job. In the interest of time, I think I will leave it at that. Just maybe requesting that all the feedback we've been giving on other teams are taken into consideration by other teams so that we don't have to repeat. Thank you so much once again. Over to you, Jocelyn.
Thank you very much. And I would just like to follow up. I think that our instructions may have been a little bit confusing. So for the groups that will be presenting in the next two sessions, rather than presenting the content of the module, we really would like you to present on your process for adapting the module. So the point, the focus of the session is not to actually practice presenting, but it's to provide an opportunity for you to discuss how you adapted the module, what challenges you had, what process you used, what your thought behind changing activities or changing content was. So I will drop in the chat just again a summary of what we're looking for. But if you, it would be helpful to start with just a very brief overview of what the content of the module is about. But you don't need to actually present the content. We really want to focus on the adaptation process and what you might have found difficult or your ideas for changes. So we really want to focus the discussion around that rather than presenting content. And our apologies for any miscommunication around the what we were looking for today. I think you all did really a wonderful job of adapting. I really liked seeing the changes that you made. So thank you very much for all your hard work on this. I know that it's not always an easy process and you all have busy schedules. So we really appreciate all the work that you have put into this. And I'll just say again, thank you very much, everybody. I know we're over time, but I'll just pass to Jintana and we look forward to the next sessions. Thank you.
Thank you very much to our excellent facilitator. Actually, I want to add that it's not only facilitator, but this reactor as well, you know. They react and then they provide the feedback to the group presentation today, right? But I think today for the whole three groups, this is the first time, the first exercise for the phase number 3. And thank you to Jocelyn to really recap what will be next that we're expecting for the Wednesday. But I like to say that today is also part of the adaptation. So 3 groups, they review and then they really make use of the material and then they focus on the content today. But we do hope that on Wednesday, right? On Wednesday, can I go to the next slide? Again, the Wednesday one, I think what we are looking for is what, what Jocelyn mentioned. I won't repeat, but I hope that on the Wednesday, we will be focusing on the adaptation process, right? Tell us how did you adapt the providing material from the GLLP consortium and how issue that you have, right? So that is the Wednesday that we are looking for. So the Wednesday, let I go back to my previous slide. The Wednesday we will have two in the group, so we have less number. So we have Cambodia, and Philippines, right? Cambodia, I think, will be focusing on biosecurity, and Philippines will embark for the quality management system, QMS, very important issue as well. So let's see how the two countries they will adopt and adapt the material to the topic that they are selected. And for the facilitator and reactor for Wednesday, again, we won't give second chance to Joycelyn and Victoria, but we also would like to introduce to you to a new set of the facilitator as well. I have Virginie is on the queue, as well as Damri from Zero, right? So you will have variety of the comment from our resource person team as well. So I hope that today is great lesson learned for all of us, and I think congratulations to the three groups, and thanks a lot for the resource person Joycelyn and Victoria. Today I like to announce and conclude that all of the participants attended the session. So that's how we learn from each other. With that, closing, and thank you very much. ขอบคุณนะคะ See you on Wednesday, same time, but different group and different sets of moderator. Big heart from the RPHL Network Secretariat. Okay. Before we say goodbye, if you can open your video, your camera, and then we can capture our, momentum that we are working together here.
Jintana
is from Selva.
Yeah.
Yes, Selva.
Yeah. Wednesday or Thursday? 7th is a Thursday.
Is that?
Confirm Thursday, 7.
Thursday, confirm
7 of
Thursday.
August.
All right.
I will email
Confirm
info
Thursday.
in the WhatsApp loop again, don't worry.
Selva. So thanks a
Thank
lot.
you.
Thanks a lot. Thanks you. So Thursday, right? อาจารย์พูดผิด they said, yeah. So thank you very much. And I see you all on Thursday, not tomorrow, but Thursday. So many video conference in my life. So thank you very much. ขอบคุณนะคะ Have a great day, great evening and great day to all of us. ขอบคุณค่ะ
Thank
สวัส
you,
ดีค่ะ
everyone.
สวัสดีค่ะ
See you on Thursday. Bye.
See you.
Bye. Selva Thursday. Right. ขอบคุณค่ะ